really fun. Yeah, sure. All right, let's give them a hand.
Hi, welcome everyone. Can everyone hear me okay? So my name is Sin. I'm from Feminist Center for Reproductive Liberation. I want to thank everyone for taking time out of your day and being here and wanting to learn more about reproductive justice. Feel free, please, if you haven't, to go grab some food. Outside to the left, we have the restrooms. And also at the sign-up table, if y'all saw, there's some pins that say no media, because we are recording and taking pictures. So in case you don't want to be in pictures or in videos, please go ahead and put one of those pins. So I'm gonna give you a little overview of what this event is going to be like today. We're going to get grounded in why it is that we are here and what the landscape of reproductive justice access is in Georgia. We're also going to have some brief interviews of our shared campaigns, like the Reproductive Freedom Ad campaign and the Fake Clinic Sub campaign. We will also have a panel discussion with these lovely people. I'll be asking them some questions, and then you all will have the opportunity to ask them questions as well. So you will see that we also have videographers in here. If you feel so inclined, you can approach Destiny right here. If you would like to share your story about reproductive justice, about what the landscape is over here, feel free to do so. And with that, I would like to welcome Destiny with Color Change.
Thank you so much, Sin. Sorry, I'm like, where should I stand? Okay. Welcome, everyone. Thank you so much for joining us tonight. I'm going to do just a quick introduction of who Color of Change is, if you're not familiar, and then I'm going to pass it over to our experts in the campaigns that we're leading collaboratively here in Georgia. So Color of Change is the nation's largest online racial justice organization, and we really are here to fight against everything that is happening in the world right now with the lens of protecting and creating a world that is less hostile and a fair and just world for Black people in America. So through that lens, our Liberated Bodies campaign, or our Liberated Bodies, is our mission of our work around reproductive justice. So before we kick off our town hall tonight, I'm just going to share you guys just a quick slide on our framing, and then we're going to get started on what's in the fight here in Georgia. Next slide, please. And so at Color of Change, our Liberated Bodies work really has framed our mission and the different campaigns that we have worked collaboratively with different orgs and groups on the ground across the country. But where we start from that is through a historic lens. And at a time in the country where our history is being erased, where we are having reproductive justice fights all across the country, we are sharing tonight a little bit of this history, and we have a pamphlet that folks can take with them. We want to make sure that we are keeping this history alive and out there as we are, merging that path forward for this fight. It's always important to understand where we've come from as we continue this fight forward, and as we've seen reproductive justice take, strides back 50 and 60 years, we are taking and just framing a little bit. So you'll see here we have some pamphlets that we'll share, and you guys can all check out liberatedbodies.org. But next slide, you'll just see it kind of just takes us through the history and where we're at today, which brings many of us in this room, is our fight for reproductive freedom. And so right now, today, we all know where we are, and so the space is really talking about how women and Black women are punished for their reproductive decisions. And so we're going to get into some of these campaigns. And so I'd like to invite Allison up to talk a little bit more about Color Change and Amplify Georgia and our partnerships and the campaigns that we've been leading. And thank you guys so much for joining us tonight.
Thank you so much, Destiny and Sin and all of you for being here. My name is Allison Glass. I am the State Campaign Director with Amplify Georgia Collaborative. And what that means is that I get the absolute honor of working with all of these organizations and incredible humans that are in this room And we work together on several campaigns, both at the state and local level, because we are more powerful together, right? And that includes all of you as well. And that is why we knew we had to come to Augusta, get out of Atlanta, because this is a statewide fight. And in fact, areas like Augusta, tomorrow night we're going to be in Columbus, really experience a disproportionate barriers to access and barriers to care. And so we thank you so much for having us here. Hopefully you might have seen maybe a social media ad that looks similar to this. You might have seen a billboard or two in Augusta. If you can go to the next slide. And we have sent out mailers to Georgia voters right here. We have done phone banking and text banking because we also want to get the input from people here on the ground. And we also did that through some focus groups and some polling specifically of Augusta people. And I want to share some of that with you because we know how key Augusta is to the rest of the state getting the rights and access that we all deserve. And, you know, we know, so the StopPolicingPregnancy.org is a new microsite that the Amplify Georgia Collaborative just launched because pregnant people are getting policed. They are getting investigated for their pregnancy outcomes, whether that is them having an abortion or having a miscarriage. And that is happening more and more across this country. People themselves, pregnant people themselves are being investigated. Providers are also being either, just the threat of investigation we know is causing delayed or denied care of pregnant people. And it is having devastating consequences. In Tipped County here in Georgia this year, and in Columbia County in 2024, law enforcement opened investigations when women went to the hospital after experiencing a miscarriage. Last year, an expert review committee determined that Amber Nicole Thurman's 2022 death in Henry County, after a nearly 20-hour delay in emergency treatment, could have been prevented. So we know that punishing pregnant people is not the way, and any abortion ban is just that. When we're creating a law, that means that people can be investigated for breaking that law. And who determines what that means is really up to a lot of question. And that is why we know that it is really the pregnant person themselves that has to have the ability to make the decisions for themselves what happens. So back to this polling, okay? I want to tell you all that we polled registered voters here in Augusta across party lines, across diversity of race, diversity of age. 87% of Augusta voters think improving Black maternal health and mortality rates is important. 60% of you all know that restoring abortion access in Georgia is critical. 75% of people in Augusta believe that you can hold your own personal beliefs about abortion and still support the pregnant person's right to have legal and accessible abortion. 75%. 81% of Augusta voters believe that the person who is pregnant is the best person to make the decision themselves around access. And 74% of Augusta voters believe healthcare should never be criminalized. And again, that means we should have no abortion bans. We should have no medically unnecessary restrictions, which has been in place in Georgia even before the 6-week ban was instituted. So thank you all so much for coming. I cannot wait for the rest of this conversation and to connect with you all and to continue connecting with you all. So please, thank you for welcoming us. Come get engaged, and we can't wait to continue fighting this fight together.
All right. So now we're going to transition, and we're going to have here Chris and Alexia tell you a little bit about the campaigns that we have with Amplify. So Chris, would you like to get us started?
Sure. Hey everybody. Hello. Thank you for being here. My name is Chris. I work at Feminist Center for Reproductive Liberation as the Public Affairs Manager and Lobbyist. So what that means is my role is to go into the Capitol during legislative session, fight against regressive policies and fight for progressive policies. And I also serve as one of the co-chairs for the Reproductive Freedom Act campaign with Amplify Georgia. Yeah, so the Reproductive Freedom Act is a piece of legislation that has been introduced in 2 legislative sessions. Right now, the bill numbers are HB 598 and SB 246. From a bird's eye view, this is a piece of legislation that repeals Georgia's medically unnecessary restrictions and puts in place protections for pregnant people to have the health care that they deserve. Next slide, please. It's really cool to see all of the different organizations that are involved with moving this piece of legislation. Some are here today, some are not. You may recognize multiple of them. I'm not going to read them off, but please take a look. Next slide, please. I wanted to ask, and please feel free to shout out, can anyone tell me a piece of legislation or a policy in our legislature that exists that directly blocks access to reproductive freedom in Georgia? 6-week ban. Yep. You think of anything else? No pressure. I have the answer on the next slide. So we can click these one by one. So, that's okay. In Georgia, we have provider restrictions. So what that means is that only physicians are able to provide abortion care. Other medical professionals who have abortion care within their scope of care are not allowed to provide abortion care. So it makes it so that our providers are lessened in this state, and that makes access to abortion less accessible. We also have insurance coverage prohibitions, which means that people cannot use Medicaid or marketplace plans to cover their abortions. We also, something we'll touch on in a little bit, is that abortion is not listed in our health code, it's listed in our criminal code, which affects us in ways that Allison was just talking about, that people are investigated for having abortions or for other pregnancy outcomes. In Georgia, people have to have a mandatory 24-hour waiting period from when they inquire about an abortion and make an appointment. So that means that people who are having to travel have to plan for that time. And since we're under that 6-week or less regulation, people are basically trying to play with time. They're trying to use all the time that they can to get the care that they need, and the clock is ticking with the law that we have in place. All patients are forced to have an ultrasound. They are not forced to look at the ultrasound, but you must have an ultrasound before you have an abortion in Georgia. When patients call to have their appointments set, they have to listen to a biased script. You may have remembered, I can't remember exactly the year, but the Women's Right to Know Act is what it's called. In the script, it talks about things that are not medically accurate as quote-unquote risks for having an abortion in Georgia. Sorry. And as you touched on earlier, the 6-week or less gestational limit, it says or less because it can be as early as 2 to 3 weeks whenever fetal tones are detected. And often much like before people know that they're pregnant. And young people also are pushed out of care because there is mandatory parental notification for all patients if you're under 18. And if you choose to go a route that is like judicial bypass, what that means is that a young person would have to go in front of a judge and ask for permission to receive care. And that is often a lengthy process, and it's not an easy process for a young person to go through or navigate. So, our piece of legislation, the Reproductive Freedom Act, would make it so that those medically unnecessary restrictions are taken away and that people are able to make informed decisions about their bodies and their health. This is a patient-centered piece of legislation. It expands access to abortion care, and it makes it so that people have fundamental protections for their reproductive freedoms. So, as you may have seen, there have been like maps going around where it talks about different access in Georgia. 95% of counties don't have an abortion clinic. So you may know people who have had to travel to Atlanta or to other cities to receive abortions. You yourself may have been someone who had to travel. And on top of that, half of all Georgia counties don't have access to care with an OBGYN. So beyond not having access to abortion care, people also don't have access to wellness visits. They have to travel out of county to have a wellness visit. If I had that big of a barrier and I was surrounded by counties who also didn't have an OBGYN, I would be less likely to receive care or to seek out care, especially if I didn't have the means to travel, especially if I didn't have anybody to take me, if I didn't trust physicians, because in this day and age, trust is very low. Some more polling that was done shows that the majority of Georgians, thank you so much. The majority of Georgians support abortion access, and 4 in 5 Georgians feel that their government should not interfere with someone's abortion decision. Another piece of the Reproductive Freedom Act is that it takes abortion out of the criminal code and puts it in the health code. And as Allison was touching on earlier, that 1 in 4 pregnancies end in miscarriage, and that means that you are more susceptible as a pregnant person to be investigated by our government, by our law enforcement. So just bottom line, when someone decides to have an abortion, they should have access to everything they need. That's timely care, that's safe care, that's legal and affordable care, covered by insurance if they need it to be, and they should have that care without any shame, without any stigma attached to it, with trust in their providers, and without fear of violence or systemic punishment. This is a long-term vision, as you know, the way that our legislature sits right now. This is a really big goal, right? Like, may seem a little far out of reach, but that is something that we're willing to fight for, and we are not willing to leave anyone behind. This is why this bill touches on so many different points, including young people, including people who are on Medicaid, including people who may want to seek care from people who are not physicians. Our need for abortions hasn't gone anywhere and is not going to go anywhere, and neither are we. So, if you want to get involved, please scan the QR code. And there's more opportunities here. Like, there's one up there. You can also just grab me after. Thank you.
I'll give you all a second if you're scanning the screen still. You ready?
So hi everyone, my name is Alexia McDermott. My pronouns are she, her, and I am the Policy and Law Fellow at SPARC Reproductive Justice NOW. SPARC is a trans, queer, and Black-led reproductive justice organization out of Atlanta, and I'm very excited to talk to you about the Fake Clinic Suck campaign, which my boss, Agbo, is the chair of, but she's on sabbatical, so I'm the chair. I'm going to say I'm the chair of the Fake Clinic Suck campaign, along with the amazing Amplify Georgia collaborative, who's helped us push the campaign and the 4 bills, which I am going to talk about later, into session last year. First slide. So first, I kind of want to give a basis of what fake clinics are. So fake clinics, first off, I'll call it many different things. They're called crisis pregnancy centers, limited pregnancy centers, resource pregnancy centers, whatever. But the thing is, they're all fake clinics. They are not places to seek legit medical care when you're expecting a child. So the bill, like a straight-on definition for them, they are nonprofit, usually religious facilities that are disguised as reproductive health clinics that do not provide contraception, sexual health treatment, or abortion services. So these facilities exist for the sole reason to push somebody into a pregnancy, whether or not they want to keep that pregnancy. But they do it under the guise of a real clinic, and they've been around since the 60s doing this work. And as of now, you can go to the next slide before I get ahead of myself. So I'm going to give because I'm about to read the next slide without reading it. I was going to give a quick history and facts about the fake clinics. So like I said before, they started in, I think it was 1967. The first one was made in Hawaii, fun fact. And most of them, like I said, are Christian-led organizations, but they're under the umbrella of these three major corporations, which is Heartbeat International, CareNet, and the National Institute of Family and Life Advocates, or NIFLA. So they're basically run under these. So what it is, sometimes like people are members of these organizations, and at some of these conferences or things like that, they'll get training to open up these clinics, and that's how some of them open up, and they fund them, they help run them, and all of those types of things. Fake clinics are everywhere. They're in all 50 states. There's no law that makes the existence of these fake clinics illegal. There is newer legislation that pop up trying to regulate their impact, but as of now, there is no law that makes them or what they do illegal. And just to give you, you can go back. And just to give you some numbers, less than half of these facilities have any medical professionals on staff, and 95% of the CPCs or fake clinics offer no prenatal services.
Do you want to tell them what CPCs is?
Oh, and CPC stands for Crisis Pregnancy Centers, I'm sorry. But I'm going to try my best to keep that language of fake clinics. The CPCs are what they're like also widely known of people trying to combat them. So if you hear that, they're talking about fake clinics. And I want to touch on some of the intersecting issues because it's the obvious of you don't want to go to a clinic and have somebody lie to you. But also, when you go into these clinics, they're very predatory on like what they believe how someone should be parented, as well as who should be a parent. So a lot of these clinics, you'll go in, and a lot of the times first off, they'll assume that you're keeping the child. And if you give any insinuation that you won't, they'll automatically assume that you want to put the child up for adoption, or they'll heavily recommend that you go through their own, what they call options counseling. They call it many different things, where they basically pressure you to go into adoption. And it's even more sinister because they have partnerships with some of these adoption agencies. So if you think of it from a religious standpoint, if a fake clinic is affiliated with the church, and that church also is affiliated with, adoption center and also maternity homes. And if you don't know what maternity homes are, they are more like outdated, but they are still very much around. It's where it used to be where people who were pregnant but not married went to have their baby back when it was like shameful to be an unwed mother. But nowadays they are for people, just anyone who they say needs support, can't afford a child. They say this is our way of helping. If they say they can't afford a child, we're giving them housing and things like that. But the thing about that is that one, the housing is conditional on you being pregnant. It's conditional on you following their recommendations. So whether they think you should keep the child or they think that it should be put up for adoption. And then it leads to all other options when it comes to racism, because more often than not, when it's a young black person, they believe that you shouldn't have the right to parent, and they'll push you into adoption. And there's like a whole realm of issues that go into the link between maternity homes and adoption centers. There's privacy concerns. Some of those big CareNet, NIFLA, some of them create period trackers for the sole purpose of tracking a young one's period, and then they'll ask for your personal information, like your email and things like that. And then they'll take the information from your period tracker and email you around the time that they realize that you're late about their services. They're very predatory. I can't stress this enough. They will do this stuff. They hacked into patient care centers and legit clinics before. And also, because they are not medical centers, which is very important, they are not bound by HIPAA. They are not bound by any of the same privacy, contracts that you sign when you go to the doctor, which is the main thing to think of when you think about all these young people who go in and give their email, their phone number, and then they can keep that information. There's nothing that says they delete it, and there's no law that says that keeping that information is illegal. And then overall, of course, this leads to a distrust in providers, because when people go into these places thinking that they're real clinics, they're thinking that these doctors are making them feel uncomfortable and pushing them into situations that they don't want. But in reality, most of the time, these are volunteers. These are people who don't know how to read an ultrasound. These aren't medical professionals. Less than half of these fake clinics are overseen by a licensed OBGYN, and even those doesn't mean they're on site. Just because they have a licensed OBGYN on staff doesn't mean they're always on site. We found, I remember one fake clinic, we were able to find one of the medical directors, and he lived 50 miles away from the center he said he was at every day. And then I put a case here. I don't know how much time I have, so I could probably come back to it. But to make a long story short, there was a case out of Massachusetts where a person went to a fake clinic for a pregnancy that she did want. But because the person did not know how to, or did not want to tell the person that she saw an ectopic pregnancy on the ultrasound, they just sent her home telling her that she was okay. And she ended up getting like severe stomach pain, and she ended up having to lose one of her fallopian tubes, and she lost the baby because this fake clinic either didn't know how or didn't notify her that it was an ectopic pregnancy, so she wouldn't get an abortion. And that once again goes into the distrust of providers. Whether or not that person who told her about the ultrasound was a provider, she's always going to remember that a provider gave her this false information that caused her a pregnancy. We're going to tap into funding. So who pays for these fake clinics? We do. You do, we do, I do. So first off, how's our federal government pay for them? They get paid through TANF funds, which is the Temporary Assistance for Needy Families. That's the federal money they get in from Georgia. In the state, over half of the fake clinics in the country obtain some type of state funding. So like Georgia, they get money from alternatives to abortion programs. There's a $2 million every year just from that grant program alone. That's not all the money they get, but just from that one grant program, it's about $2 million. And of course, the private donations from like the license plates, stickers, things like that go to fake clinics. Anyway, it's the last slide. And then just to close out, this is our bills under the Fake Clinic Stop campaign. I'm just, once again, going to run through this. We have a handout over on the Amplify Georgia table of like the language of these bills. So first off, the Pregnancy Center Fraud Prevention Act. This will prevent false advertising of these clinics. So like I said, although none of these clinics, well not none, although most of these clinics have no medical professionals on staff, they'll still post pictures on their website wearing scrubs or pretending to be nurses or things like that. This act would make that illegal and prevent them from providing misleading information. The next one basically goes after the money. We want to say we don't want you to use our state funding to falsely advertise to people. So the End Public Funding Misinformation Act would revoke that funding. And then the resolution, this was presented on both sides, so we technically have 4 bills under this campaign. This means that that bill will redirect the money that would go to these fake clinics under the state grant program to the Georgia Home Visiting Program. It's a program created by the governor to help out families and children. But yeah, these are the bills that we came together to basically combat the impact that fake clinics have, at least part of it when it comes to the media aspect of it. And yeah, this is just our mailer. Once again, fake clinics outnumber real providers 7-1 in Georgia. It's even worse in other states. And then I think that's the last slide. And that's just another fact sheet. This is a sample of our mailer that went out, I think, a couple months ago. But yeah, thank you so much.
Okay, so we're going to transition into the panel now. And with that, I would like to welcome Kay Turner. So let me tell you a little bit about Kay. Kay Turner is a mom, a small business owner, educator, and advocate with over 12 years of experience in the beauty industry. Her passion for empowering others through health, self-care, and community connection has shaped both her entrepreneurial journey and her civic leadership. She served as an ambassador in the Southern Poverty Law Center and Collective Renaissance Guild program, working to strengthen voter engagement and civic participation in underrepresented communities. She now continues this commitment as a community liaison with Learning for Justice, helping bridge communities, expand access to resources, and create inclusive spaces. Through her combined work in wellness, business, and civic engagement, Kay remains dedicated to uplifting families, amplifying voices, and building stronger, more connected communities. So give it up for Kay. Yeah. Welcome, everyone. One moment. So, Chris, we're gonna start with you. Because you didn't do enough talking, right? So I'm gonna give you some more. So, one of the most important critiques of the Reproductive Freedom Act campaign makes the subverting the idea that abortion access in Georgia was sufficient while Roe v. Wade was still in effect. So we know that many of our community members, particularly Black, Indigenous, people of color folks, working to make ends meet and on Medicaid. How does the long-term vision of the Reproductive Freedom Act, say in like 5 to 10 years into the future, how does it offer a new chapter of abortion access in the state that remedies both historical and current conditions?
It's a big question. I want to say that the Reproductive Freedom Act is different than the status quo that we saw before when Roe v. Wade was in place. When we had a 22.5-week ban, people were still being denied care. People were still being pushed out of care because we had these other abortion restrictions in place. The Reproductive Freedom Act centers patients, it centers Georgians, and it makes it so that patients are in the center of the decisions that they're making, and the decisions are not being made for them by providers. So the Reproductive Freedom Act is a long-term vision, like I said earlier, but it makes it so that every unique pregnancy, because every pregnancy is different, every patient is different, is honored and is supported in like multi-level ways. So somebody's able to receive care because they're able to afford it through Medicaid, or somebody's able to receive care as a young person because they don't have access if they're in an unsafe situation. Somebody's able to receive care because they are 6 weeks and 1 day pregnant. I think that person-centered care is the real like heart of this bill, and really taking pregnancy and abortion out of the criminal code makes it so that people are able to trust providers again. It's going to be a slow process to get that trust back. I'm just going to be honest. If providers are at risk of being criminalized, they may feel more inclined to turn their patients in or question decisions that are being made. But if they're given the freedom to take care of their patients in the way that they have been trained to do with their Hippocratic Oath, and they are trusted to be providers, it makes it so that trust is built again. It's not going to be overnight. The bill cannot make it so that people trust their providers again, but it can make it so that providers are able to build that trust back.
Thank you, Chris. All right, so Alexia, we heard you telling us a little bit about, or a lot. You told us a lot of information about the Fake Clinic Suck campaign. So we know that the movement is seeking to defund anti-abortion centers in Georgia. Now, given the charged political climate, what is the core message the campaign is using to build a broad coalition? And what specific advice do you have for our community members and local advocates who want to bring this conversation up with their state and local elected officials in Georgia?
That's a good question. I think like the broad message, like not to take it from my shirt, but doctor's not deception. When we go to the doctor, we don't want someone to lie to us. I think it's the core thing, and something we can all like connect with, because we all have to go to the doctor. The fact that we're going, or someone may go to a doctor for reproductive means, doesn't mean that they should receive less care or be allowed to be lied to and it be legal and it be protected by a C3 status or a nonprofit status as it stands. So I think when talking to legislators, this like kind of bring it back to healthcare, because reproductive healthcare is healthcare. And it's very important to our everyday needs. It's not just, something that's elective. So I think really pushing that that healthcare is essential for our day-to-day functions, and that we don't deserve to be lied to. We're paying all this money. We pay health insurance premiums. We pay taxes. We pay everything to get the healthcare that we are not receiving, and the most vulnerable among us aren't only receiving it, they're being lied to when they try to. So I think it's the main thing to really hone down is you don't want deception in your healthcare.
Thank you, Alexia. Okay. Would you please tell us about access on the ground here in Augusta? Where do people get reproductive health care, and what would you say that are the challenges in here?
So for Augusta, we actually have no outlets now. We used to have a Planned Parenthood. The Planned Parenthood is gone. Even looking at the difference between, so I'm a mom of two boys. Woohoo. My oldest is 14, and my youngest is 1. He'll be 2 in November. So yes, pray for me in that big gap. And with that gap, as a mom, I was able to see the difference between 12 years ago when I had my first, 14 years ago when I had the first one compared to the second one. And we did have resources, but as a black woman, those resources, what we're advocating for today, I experienced that as a 21-year-old pregnant. Fast forward, I experienced the same thing with even lesser resources. So here in Augusta, we have a desert for that because experiencing it myself, you know, so many things have changed from the car seats walk now, the bottles talk, you know, it's so different. So even, you know, becoming pregnant, I had complications in the beginning. I had a fibroid growing the same size as my baby. So when I found out I was pregnant at 6 weeks, 2 weeks later, I was in the emergency room every day for a week straight. And I think the gray area that we're missing with this issue is the fact that this actually turned into an economic crisis, you know, like, and then you think about the baby, but there's nothing in place for the mom, you know. So now we're talking about mental, your mindset. Mind you, I'm in a new climate now. We didn't have all this going on 14 years ago. It was just discrimination. Now we got discrimination, laws, rules. This is crazy. So there was a chance that I could have lost my child. You know, and the fact that I probably could have lost a child from stressing that I might lose the kid because of the access and then the lack of doctors. It took me 3 months to see a specialist. So I could have lost a child in general because I didn't even have access to a doctor. So I had to rely on God for one. But everybody does not have that faith. Everybody does not even have the will to even know to turn to that. And that was just ridiculous. It was ridiculous knowing that, hey, I'm not even sure what's going on with my body. I'm in my 30s now. This is new territory. There's something else growing here that's racing with the child, and you're telling me that I can't see anybody until July. You know, this was insane. So I can say that there's a lack of resources now, especially compared to what we had before. We don't have a Planned Parenthood. We don't have, now we do have fake clinics for sure. But then access to doctors, access to, I even had an issue to where when I did go to the doctor, mind you, I had to wait 3 weeks. They didn't take my insurance. It told me the day of. So I was back. Like I said, it was nobody but the grace of God that my child even made it. But then also the fear of what if my kid didn't and now I'm in jail because of some things that I could not control. So just from a personal experience and knowing what the climate is now, there's a lack of resources and it's very scary. I still think that even with everything that was just going on negatively, I'm very fortunate, honestly, because I still know that there's individuals who don't even have transportation. You know, there's the thought of traveling. I had to travel so far just to get to the doctor appointment, but everybody does not have that access. I mean, then we're already facing the transportation issue here as well. So the desert is all across the board. So yeah, we do have a lack of resources here in Augusta, and it's alarming, very alarming.
Thank you. Thank you for sharing. Following from that, I would like to ask you, what's your vision for reproductive freedom in Augusta?
Well, first, I think we should start a riot. To resources, education around reproductive freedom, whatever a woman decides, because we have these issues, there's not a lot of education around just healthy pregnancies. There's a false narrative that we have across America. The false narrative is that you get a baby, you get a baby, you get a baby, and everything is going to be okay. This is a great place to have a baby. And that's a false narrative. And data shows that for one demographic and that I represent, we're dying having kids. So sitting here planning something that's so delicate, you know, something that you should be able to have a choice, that's unrealistic. So a vision for that is healthy spaces, you know, quality healthcare, access to the healthcare, more physicians that individuals can get to for sure, whether it's for abortions, whether it's to keep the child, just to have that access. So initially, that's what it needs to look like. It needs to actually look like what the positive narrative is, that you can have a child and you have the resources. You can have, or you can make that decision for yourself, but you'll have the resources for the A or B, either way.
Thank you. So I'd like to ask you another question.
What?
I know you've been a community leader for a while, and so I would like to ask you, what would you recommend for someone that's like trying to get started in like advocacy, trying to get involved in what we are doing?
Really just jump into it. We have a lot of organizations. You all are all credible. And I definitely say get on the train, educate yourself on the pamphlets, on what else, and on all the other things that we're facing. Because like I said, what's missing is the fact that this is an economic situation. This is turning into a whole nother big ball game. So this is going to involve fathers, uncles, moms, grandparents, the children itself. So initially it needs to be everybody. So anybody that wants to get involved, actually just get involved. Pick one, show up and advocate, because me being a mom, I can't just do this on my own. This is for real. This is serious. I've had having these personal experiences and knowing that, wow, there's other individuals out there